Hello everyone. Have you heard the quotation about the diet that you are what you eat? Right. Everyone will be heard this, right? But big change I am doing in this quotation for today's session. That is, you are not what you eat. You are what you digest and observe. Right? You all agree with me? Because our health will not only dependent on our diet, but also how it will be digested and observed will be result of our health, right? So on basis of these, our poop will show us many early signs which will be caused into diseases in further days. That facts no one will explain you, because obviously we will go to the doctor when the complaints start in us. When the complaints of our diseases starts, then only we will go to doctor. So some laymen or the persons who are not related to medical field will not get the early signs, right? So today my session will be on early signs of poop, some facts of poop which will show you the early signs of diseases. So let's begin with the topic. Welcome back to Dr. Meenakshi's Medica. This is Dr. Meenakshi, BMS MD, IU, that is Ayurvedic pediatrician. So today I am explaining some facts about our poop which will show you the early signs of diseases. Let's start. That is fact 1. If you have to go for the poop or passing motion 5 to 6 times or more in a day, then this is the clear sign of IBS, that is irritable bowel syndrome or intestinal bowel syndrome. Fact number 2. Sticky poop is a sign of toxic metabolism present in your body. If you are passing a sticky stool, then it's a sign of metabolic toxic present in your body. Fact number 3. If you need to go for washroom or passing a poop with lot of pressure, or if you're straining a lot while passing the stool, then you need to work on your gut, because it could be a sign of early sign of piles or hemorrhoids. If you're going to suffer with the piles or hemorrhoids, then early sign will be hard stool. Obviously, in hard stool, what you will do, you have to strain while passing the motion because of hard stools, right? So, and you have to give a lot of pressure. Due to this, if you repeatedly strain while passing the motion, this sensitivity of the skin will be very sensitive in this region. So they will wide open, or they will cut, or they will have a skin tag, etc. So this will lead to the piles or hemorrhoids. So if you are giving way much pressure while passing stool, or if you are getting repeatedly hard stools, then you have to work on your gut health. Fact number 4. Black poop is a sign of bleeding in upper gastrointestinal tract. So, but unless if you are not on a supplements of iron, if you are taking any supplements of iron, then obviously your black poop will be black. Instead, if you are not taking any iron supplements, then too you are passing a black poop, then it's a sign of bleeding in a upper gastrointestinal tract. Then fact number 5. Erratic bowel timing, like timing of a poop may be post meals immediately, or at night time, or during the evenings, or after stimulation, like after having tea, coffee, or after having cigarette, if you are feeling to have a poop. Because our normal routine will be early in the morning, after getting up we will pass the poop or we will pass the stool. But if you are feeling, or if you are getting the stimulation to or pressure to have go for the poop immediately after meals, or in night, or in the evening time, or after stimulation, like after having tea you want to go for washroom, or after having coffee, or after having cigarette you will get a poop, then it's a sign of poor gut health. Your gut is very poor. The health of a gut is very poor, so you have to work on it. So these are the 5 facts which will give, which are poop. our gastrointestinal tract will give a sign, early signs of further diseases. If you neglect these 5 facts, then obviously, as I mentioned in some points, which disease will be caused, you will be caused that disease and you have to work on the disease later. So if you're getting any of these early signs, then work on it, correct your gut and have a happy health. And if you want any of the treatment way explanation about these 5 facts, then let me know in comment section box. I'll go through. Thank you.